Here.
John Bonifay. Brad Olson,
Here.
Pam Garvey,
Here.
Ray Johnson,
Here.
William Oliva,
Here.
Rita McKee,
Here online.
Dave Magnifici,
Here.
and Dr. Lagus.
Here.
Okay, roll call. With that, I'll entertain a motion to approve the agenda.
So moved.
I'll second. Okay, motion's been made and seconded to approve the agenda. Any discussion? With that, I will call for a vote. All in favor, say aye.
Aye.
Opposed, same sign. Okay, and then moving on, approval of the minutes for the January 14th, 2025 meeting. Any questions on the minutes? Nope, I'll entertain a motion to approve the minutes.
So moved. Second.
Okay, motion's been made and seconded. Any discussion? With that, all in favor, respond by saying
Aye.
opposed, same sign. Okay, motion carries. Number 5, public comment for 3 minutes. Do we have any members of the public that are here that would like to make public comment, or is there anyone online? Does not appear so. So with that, we will move on. Number 6, receipt of information from supervisors not seated as committee members. Do we have anyone here who would like to share anything with our committee today? Doesn't look like it. So, okay, we will close that section and move on. Number 7, Golden Age Manor update 2024. Do we have Dana?
She's on, yep.
She's online. Okay,
Yes. Hello, can you hear me?
sure can. Take it
All
away.
right. Let me get my camera here. Hello, everybody. Just a quick update here from Golden Age. I'll start with staffing. So we've talked a little bit about our CNA training program that we started in January of 2024. So have that full year under our belt with that. It's been extremely positive. It's just been amazing to have that program here in our building and to be able to train new CNAs. So we've trained 24 new CNAs, and 21 of those are still working for us. So that's been extremely positive. Some of those are high schoolers who just work casually for us or maybe on the weekends. Several of them are full-time employees. So on our night shift, day shift, PM shift, actually all shifts, we have some of our own trained CNAs. So that's been great. We have classes scheduled. We have an April class scheduled and a May class scheduled, and those classes are full. So been very positive for us and for the community. We are recruiting for nurses. We've had some retirements recently, so still recruiting for some either RNs or LPNs. Our financial audit well, it's not complete yet, but that is getting there. We should have our draft financials soon. So we will share more on that later, but we did have a great year for 2024. Our census has remained strong, remained steady through 2024 and into this new year. So we continue to be right around right around where we budget. So that's been positive. Capital projects for 2024, we did finish our kitchen project. I think I shared about that when we had the meeting here at GAM. But that project just totally wrapped up, so that was great. We did a sunroom kind of remodel, got some new energy efficient windows and whatnot. So as you all know and can imagine with our old building, it's a constant job to keep it moving. So our maintenance staff here do a great job planning and keeping the building up and running. So that's about all that I have for a quick recap. If anyone has any questions.
Does anybody have any questions for Dana?
Just a comment, Dana,
Yeah.
if I could.
Yeah.
Congratulations on your CNA program.
Thank you.
It's great.
Yeah. Thank you.
Yeah, that's It's quite an achievement. That's quite a few to train and then to retain that many on top of it.
Yeah. It's exciting.
Really.
Mhm.
I have
Pam,
one just
Pam has
quick,
a question.
just a quick question, and
Yeah.
I'm kind of putting you on the spot, so we definitely don't need the exact numbers, but since we've got the commercial kitchen project coming up later on the agenda, I'm just curious, do you have just kind of a ballpark what your costs were to update the kitchen at Golden Age?
Yeah. So ballpark, it was right around 100,000. And that was, it wasn't like the equipment person. There was a little bit of equipment in there, but it was mainly the floor, the ceiling, the wall surfaces, which some are like stainless steel, plastic type. And then we did get one like new grill. But for the most part, well, and the other big cost was actually taking all the equipment out and putting it back in because it's all, hardwired and plumbed. So that had to all be completely, taken out by professionals and reinstalled. So yeah.
All right, thank you, appreciate it.
Yeah.
Thanks, Dana, very much
Yep.
for that report. No one else has anything for Dana. We'll move on to our next item. Our next item, then number 8, is Veteran Services Office update. Good morning.
Good morning. So I don't have much for updates other than Gail's replacement. So if anybody doesn't know, after 40 years with the county, Gail Wasberg retired. Her last day was January 31st. So Nicole Schmid from Land and Water will be coming up and joining me. So looking forward to that. She'll be starting on Monday. So getting a lot of questions and phone calls from veterans regarding VA terminations and layoffs and things of that nature. So right now, there's basically, it sounds like 80,000 positions that are on the chopping block. So starting in June, a lot of those positions are gonna disappear. I have no idea if it's gonna impact benefits or healthcare or anything like that. I would have to imagine, being 15% of their overall workforce, it's gonna have some type of impact on services. So time will tell what that looks like. Just kind of waiting for that and see what happens. So I know a lot of people are concerned with it.
Thank you for letting us know about that, Andy, and hopefully it won't trickle down too bad.
Right.
Hopefully not. So do we have any questions about anything else or? Nope. Well, these updates are going pretty quick then.
Right.
Okay, thank you so much. So with that, we will move on to number 9, which is our child support update.
I don't have a lot to update on either. In 2023, we had a significant increase in our numbers. 2024, we maintained those or relatively close. As far as this year, it's looking like we're improving. But we don't know what will happen with changes in the economy, layoffs, all of that contribute to how people pay. One thing we have done is we've adjusted our caseloads. There were a couple workers that had a significant amount of more cases than other workers. So we adjusted so everyone's right around the same level. We continue to evaluate cases for account seizure. Once in a while, you can bring in a significant amount of money towards arrears. We've also increased our court time from 1 block to 2 blocks per month. And we are also thinking of how we can make that better because there's so many cases in those 2 blocks per month. We're not able to schedule more. So I don't know if we can increase court time or add another date. We're kind of mulling that over in the office. And always we encourage training on child support policy, maintenance, management, anything that can improve our performance. And we've started doing monthly staffings when everybody's around. It's hard to say what's going to happen. I mean, we're facing many payers that have criminal matters, health conditions, social security, all that affects how someone pays their child support. We're expecting to probably be in court more now to right-size orders, modifying those orders so a payer has the ability to pay. And I guess my last thing is we are in the process of cleaning up old cases. We are on a 10-year timeline now for a new system that we would operate and manage our cases through. I think final rollout date is from 27 to 29, but it's supposed to be a system that communicates better with the other agency systems that we use. It'll communicate better with CCAP, make it easier to learn and process as well as manage our cases. Right now, I think I'm right around 300 cases that I have to go in, file something with the court to move all old data to the court record so we can adjust it and take it out of our system.
Sounds like a big job.
It's tedious, but it'll get done.
I wanted to ask about what is the average number of cases that each staff member handles?
We're right around 1,550 cases, so that's distributed between 4 workers.
That is a lot. If I recall correctly too, weren't you part of the team that got an award for the,
Yep, that was for our performance in 2023. That hasn't been released yet. Hopefully we get another one.
yeah.
Anybody have any questions?
Anybody have any questions? No? Okay, thank you very much for that report. Okay, coming up is our 40-day immunization report.
Want an intro?
Pardon me?
Yeah. So Crystal King is one of our RNs. We'll be giving the 40-day report. Helen will be her backup singer. We're as needed, lifeline, whatever. So
We need a mic.
Helen is distributing PowerPoints, and as soon as that happens, we'll let Crystal tell you a little bit about herself and take it away.
Okay, thank you, Crystal.
All right, so my name is Crystal King. I am a public health nurse here. I've been here for almost 3 years. I've been an RN for, I believe it's about 6 years now. Before I worked here, I did work in a hospital.
And you're very soft-spoken.
A little nervous.
Don't be nervous. We won't be too tough on you. You can go ahead and speak up.
Okay, I will try. So an overview of what we're gonna cover in this presentation is the foundation of our immunization program, the current work that we do, the immunization rates in our county, and the school 40-day report, and the impact of a disease outbreak in school.
Okay.
So the immunization programs are mandated per the Wisconsin State Statute, Chapter 252. And it states that immunization programs were established to help eliminate measles, mumps, rubella, diphtheria, pertussis, polio, and other communicable diseases. The state statute also states that any child admitted to any elementary, middle, junior, or senior high school, or into any child care center or nursery school should provide proof of immunization status or shall present a written waiver. So what we currently do is we share credible information with our community. We give vaccines as well. And with that, we do annual flu shot clinics. And we are currently working on our RICE 3.0 grant. And then we also send reminders to families for vaccines and or their well child visits. Okay, so for sharing credible information, we collaborate with our community partners and our clinics to ensure we are all aware of like up-to-date information and recommendations. doing this, like last year, we created informational letter on RSV that we sent to all of our clinics to let them know that we are able to immunize those eligible through us to get RSV vaccine, and that they were aware of who should be getting that in the fall. We've also created handouts and flyers and social media posts, and on there's just a little snippet of one information handout that we have created that we made available to the schools. And then on the other side is an example of a social media post, because January was Cervical Cancer Awareness Month, and we promoted HPV vaccine with that. So to give vaccines, we do this to increase uptake of routine immunizations and help prevent vaccine preventable diseases in our community. To increase access, we focus on these populations at the health department, and that is children who are 18 years and younger, and they must be either uninsured, Alaska Native, or American Indian, have Medicaid or eligible for Medicaid, and adults who are 19 and older and either uninsured or underinsured. We offer flu clinics in all 8 of our public schools every fall. And then we also offer flu vaccines here to the public and employees at the government center. In 2023, we gave a total of 659 flu vaccines, and in 2024, we did 695 vaccines. And right now, we have the RICE 3.0 grant, and that is routine immunizations through community engagement. For this, we are focusing on partnering with our schools to provide vaccine clinics at their locations. We've also partnered with Burnett County to do the same at their schools. We have been doing 2 rounds of clinics. We did one at the beginning of the school year, and those were mainly in August. And we are currently in the process of doing another round now. And those have been started in February, and I think our last one is in April. And we've also partnered with the St. Croix tribe. We send reminders monthly, and families are either notified by text and postcard. Child may be due for vaccines and or a well child visit. We believe doing this helps to prepare children to be on time to meet school requirements.
Excuse me, Crystal, can I ask a question, or do you want me to save it till the end?
If it's on this, you can ask me.
Okay, sure. So I'm just curious, the notifications that you do, how do you know who to make notifications to initial contact wise?
So what we do is we go into WIR, the Wisconsin Immunization Registry, and then you can like pull reports in there. And what I do is I go in and I select like people that reside in Polk County, and then I pick like a date of birth range. So we typically focus more on like younger kiddos. So I'll say like, I'll do like June 1st of 23 to July 30th of 23. So usually it's about a month at a time. And then I'll pick certain vaccines, like the ones that they should have. And then it pulls like all the names of those that, and usually it's only kids that are missing a vaccine or don't have any vaccines that end up on the report.
Interesting. Sounds like quite a database.
A little bit sometimes.
So that is, none of that is income based then. It's just straight reminding parents that their child is due for a vaccination.
Yep.
Thank you.
Interesting.
Okay, and then this is based on ACIP and CDC recommendations. They put out recommendations on what children should be immunized on and the schedule that they should be immunized on. Here, what is listed is what they should have by the time they're 24 months old. So they should have had 4 doses of DTaP, 3 doses of Hep B, 3 of pneumococcal, 3 of Hib, 3 polio, 1 MMR, and 1 varicella. And then we call this a benchmark. So the little graph there that kind of shows like where Polk County is measuring against the state of Wisconsin overall. vaccine levels on who is meeting all of those recommendations.
Looks like the postcards are working as.
No, because we've been doing for this, like the younger kids, we've been doing that process for about 2 years. So I believe it has been helpful.
Can you explain what that red line means?
And then we put the red line on there, and that's kind of to show, since we'll be talking a little more about measles, for it to be considered herd immunity, you should have a 95% vaccine rate. So we just put that in there to give a little perspective on that.
Which color is Polk County?
Polk County is orange and the state is blue.
Okay.
What is the 40-day report? So the state immunization program requires school districts to complete a yearly report to show compliance with the Wisconsin student immunization law. This report is due by the 40th day of school, which is typically around mid-November. And the purpose of the report is to assess and monitor compliance with the student immunization law. Is what is required by the state for kids. So going into kindergarten through 6th grade, they should have 4 DTaP, 4 polio, 3 hepatitis B, 2 MMR, and 2 varicella. And then when they get to 7th grade, they have all of those, and then they need to get a Tdap and then a meningococcal vaccine. And then by the time they're in 12th grade, all they need is a meningococcal booster. So if a child stays up to date by the time they're 24, and then by the time they get to kindergarten, they will only need 3, 1 polio, 1 MMR, and 1 varicella. And then based on like CDC and ACIP recommendations, all of these doses can be given at 4 years old. There is a one little difference in the immunization schedule on what school requires, is that school only requires 4 DTaP, but to be fully immunized, they should have 5 doses of DTaP. And then other vaccines that are not like school required are hepatitis A, pneumococcal, Hib, rotavirus, HPV, and then seasonal flu and COVID.
Crystal, what is the one you were just saying, that Tdap, what is that for?
The Tdap. So it's like the older kid version of DTaP. So the Tdap protects against tetanus, diphtheria, and pertussis. So a lot of like we've been hearing a lot of like pertussis and whooping cough is going around. So getting that gives protection against either getting it or lessens the severity of getting.
I was wondering if tetanus was in there somewhere.
Yes. So and then that's one that's even when you're adult, it's recommended to get every 10 years.
Thank you.
Yep. Okay, so then for our roles, what the school does, is they review the immunization status of each student, including waivers every school year. And then they send the reminders to families of students who are in need of immunizations, and then they gather waivers as needed. And then they submit the report of immunization status and waivers. And then here at Public Health, is we support and we're a resource to the schools. We make sure they have like the updated booklet from DHS every year. And then we can provide vaccines to students that the schools refer to us if they fall within like our guidelines on who we can give vaccines to. We also gain situational awareness of waivers and vaccine rates at schools. And then we can evaluate these rates and potentially guide further programming. And if they ask us a question that we don't know, we reach out to our regional representative, Shayna, for assistance as well. Just to give a little perspective, we don't get like any identifying information with that. We just get numbers, and that's due to what's called FERPA, or the Family Educational Rights and Privacy Act. That means the school cannot release a student's information, including immunization status, to the health department unless there is a health emergency, such as an outbreak of a vaccine preventable disease at the school. Okay, and then here is some facts on our current school year. We have 6,251 students enrolled. And then of those, it's 5,420 students, or 86.7% are meeting the minimum state requirements. And then 831, or 13.3% of students do not meet the minimum requirements. And then minimum requirements can be affected by students who are behind schedule, or they have a waiver on file for either medical, religious, or personal conviction. And then the number of medical waivers that we have is 14 students. Religious waivers is 77 students. Personal conviction is 573 students, for a total of 664 students have waivers on file. And we have an additional 167 students who are either behind schedule, in process, or do not have a waiver on file.
What was that number? How many?
167.
So it looks like there's no data for 2020.
Yeah, so 2020 was a little bit of an exception. I think that was more COVID.
Yeah.
And they could do two ways. They could either submit all students, or they could just submit kindergarten. I believe that's what it is. And I think the schools just submitted kindergarten. So it really wasn't that comparable. So I think we just kind of left.
Crystal?
Yeah.
Can, going back to the page before that, on your kids, 6,200 in schools, do you have information where you can break that down by school?
I think we can. I think because each school reports individually. So
Okay.
yes.
The reason that I'm asking is, so out of those kids that are not immunized or behind, you can then somehow compress your data to see where there are outbreaks of certain diseases?
I think, yes. So I think for us, it would show like who would be more at risk, because it's like, oh, they're behind schedule, they're not vaccinated. So I think it would be able to show us which schools might be more at risk. Yes.
Are you seeing that?
I don't
I
think
don't
we've
want to throw
been
anybody under the
seeing right
bus, as
now.
they say, but I'm just
Right.
curious if you're seeing trends in any of the 8 school districts in the county where there is a large number of kids that are not vaccinated.
Not that I'm aware of right now. I think pertussis kind of hit just where it hit. I
It's a
don't know if
equal
it was,
opportunity.
yeah, I don't think it was in any one school more than it was another.
And we haven't had, well, no measles, no varicella. We haven't had any of the bigger,
The bigger, yeah.
right, that would escalate to, an outbreak and excluding kids and quarantine and stuff. So
Lots of flu and lots of norovirus this year, so.
Yes,
that's what we saw a lot of.
And the theme is flu and stomach virus.
Well, I'm just thinking of intertwining kids between all the activities that they have.
Yeah,
That's, between music and athletics and field trips. Okay,
true.
thank you.
Dr. Lagus, did you?
I was gonna comment on measles. There's an epidemic, as you all know, in Texas.
I have some. points.
I started in St. Croix Falls in 1966, and I think I saw my only case of measles in about 1968. Somebody had a rash. But other than that, they were not particularly ill and recovered. So there's been a lot of controversy with measles vaccine, people claiming that it caused autism. But that was by Dr. Wakefield in England. And finally, the British took away his license to practice medicine in Great Britain because of this disinformation campaign. But he still goes around the world peddling the misinformation. And it's so there are kids who get really sick, and I think there's been 189 cases in Texas so far.
Wow.
In a group of people in the Mennonite community, and I don't want to disparage Mennonites or any other group of people, but they have bought into that, or for religious reasons or whatever, they're not doing it. And so there's 189 cases. There's been one death so far. These kids, when you get 104, 106 fever, well, it kind of cooks their brain, and sometimes these kids are never the same. And in fact, know of somebody in St. Croix Falls whose child had chicken pox, and they're not quite as bright as they could have been. And so I think we have to really try to convince people that they need to keep up with these things, because you really need at least 90% to get herd immunity. And so we're close at 86%, which I'm happy to see, but it will not provide herd immunity. And so it's kind of like, okay. And there was an epidemic in American Samoa. And they had 1,200 people in the hospitals, 60 children died.
Wow.
And then the health department stepped in and immunized anybody, and everybody was willing to take the vaccine. So those things happen. So I think I thank you for all the work you're doing.
Supervisor.
Yeah, I just had one quick question, and you might not know the answer to it. I'm just, you kind of started off with, we have state statute 252 that says they have to be immunized, or they have to provide a waiver. So you mentioned something about 167 that don't have anything. How does that work? I mean, and I'm not saying that that's necessarily your responsibility, and I don't know, maybe that's something Mr. Aliva can allude to better, but I'm just curious, does it just go on forever? What happens?
I guess I can't fully speak to that, but it really is typically the school's responsibility, because like I said, the FERPA Act
Sure.
prevents them from giving us information unless the parent gives signed consent. Then they can give us that. But I think if the parent isn't willing to do anything, then I don't think they'd be willing to share that information with us, if that makes sense.
Absolutely.
So they should
I
be
know-
excluded from
Yeah.
school.
Should
They have, excuse me, I was gonna say, they have, once they're enrolled in school, when they provide their immunization records, if they don't have them, they have 10 days.
Okay, and they can be excluded from
And
school
then they can
then?
be excluded from
Okay.
school for those 10 days. And then if they don't provide that information, then they must provide that waiver.
Okay,
And the state provides the waiver. The school does not provide the waiver.
sure.
We are able to file a child in need of protection services too, under chapter 48, if a child is not immunized.
And there's no waiver on file. Got it.
We've
Okay.
done that.
No,
Oh,
right.
I was
I'm
gonna
not
say, that's never, to my knowledge, that's never been done.
Okay, thank you.
Dr. Luttis?
When I was doing physicals for people going to University of Wisconsin-Madison, they required these people to be up to date on their immunizations, or they wouldn't admit them. And so I think maybe we have to start reminding people who are thinking of going on to higher education that the colleges don't want people coming in there and causing an epidemic on their
Campus?
on their premises.
Understandable. Just a quick question for some free medical advice, Crystal. So as adults of a certain age, do you, if you had an MMR shot as a child, do you need to get another one now that measles is making a little bit of a comeback, or these other diseases? Do you need to get re-immunized?
So I was just on a call with the state yesterday, and I believe that was one of the questions, and they said that if you have proof of 2 or you have proof of a titer, which that's how they can measure your immunity. then you wouldn't have to be re-immunized. So I think it's a little bit up to you if you haven't had to, if you want to get another one, or if you just want to get a titer.
So for people that don't know, what is a titer?
They have to draw your blood and then they run it for a test of what's, I think, is that IgG?
If you have the antibody.
They'll look different.
Yeah, it's looking for antibodies. Yes, to make sure you're immune. And it has to be a certain level to be considered immune.
Most of us who, I grew up, before there were vaccines, we probably had measles or mumps and chickenpox, and all those, infections, and somehow we survived.
Well, we didn't all survive, which is why they had all those childhood, deaths. But, and many people, their titer is, where they get the titer if they've had the childhood diseases, somehow are not immune to mumps. And so we saw that a lot where they'd have to get another MMR because maybe they had measles, but not mumps immunity. And so the shot doesn't hurt, never hurts to get another booster. I mean, it doesn't cause harm to get another booster, but the titer sometimes is surprising results when you think you've had it. Maybe you didn't have a strong enough case or something. Excuse me for interrupting.
Thank you for the
Thank you,
update.
Rita. Okay. So this is a little bit of just a brief overview of what would happen in a measles outbreak. So a case of measles would be reported typically to the health department. And then we would notify the school that that child would attend. The school should review immunization status of all their students and staff. Students and staff who are not vaccinated or do have a signed waiver should then be excluded from attendance. If they receive an immunization within 72 hours of exposure, they may then return to school, but then they would be monitored for signs and symptoms. If they don't get the vaccine, they are then excluded for 21 days from the date of onset of rash in the last identified case. And then they should also get a second dose of MMR at least 28 days after the first dose. And 2 doses of MMR are proven to have 97% effectiveness in preventing measles. So a little example we have is, say a school had students and 86.7% of those students would stay in school, and then 67 students who are not vaccinated and or have a signed waiver would then need to be excluded from school unless they can provide up-to-date vaccine status. So return to school would be based on if they can provide vaccine status, if they develop measles, or the rash onset of the last measles case.
So one case is an outbreak, one reported case. So we have one positive in one school. Depending on the campus structure, if all of the buildings are connected, they need to look at the entire school. If it's just in the elementary and it's separated, they would only look at the elementary and do the exclusions based on that. For example, a little different from COVID, what we would consider an outbreak.
I have one more comment if I could.
Of course.
Actually, measles is highly infective.
Mhm.
And so if a person with measles rash comes into a examining room, that examining room is basically contaminated for several hours because the measles virus just is in the air. And if somebody has not been vaccinated and they walk into that room, they can get infected just from the air, even if that patient is no longer there. So if somebody comes with measles, basically the clinic would have to shut down that room for probably the rest of the day so that other people don't get infected. It's that infectious.
Could I make a comment also regarding that infectious component? The excluded, you know, like if the elementary school is secluded, if they all ride the bus together, I would think that may be a concern, when you find a case, knowing if they're a bus rider. And because there's other kids on that bus that go to other, you know, other levels of the school. So it's just a tough situation. It's so contagious. I don't know, has that been addressed at all, the bus transportation?
They would do the contact tracing to
Yeah.
drill down on where all of the exposure was, Rita.
Okay, all right.
Mhm.
Thank you.
That's a good point.
One other thing, thanks Rita for stealing my thunder.
Oh, sorry.
School bus. The other thing that I was thinking of for the schools that don't have nurses.
Yeah,
The interesting thing is, you know, the comment that you have here, is that, they have to be monitored. Kids have to be monitored for, you know, if
true, yeah.
they're gonna come into a classroom or wherever they are in the building. The interesting thing is, you know, just kind of a thought here, who monitors them?
That's a great question. Since that was just like in like the CDC guidance and everything, it doesn't necessarily say who is monitoring. Like if it's a staff, I would assume they could probably self-monitor. Oh, if I have a fever, I probably shouldn't go to work. Or like if it's a child and their parents shouldn't be sending their child to school when they have a fever. So I guess it's kind of,
Well, I will tell you where it falls, because I know the answer to that question. It's gonna fall on that classroom teacher.
yeah, probably.
And then of course, now the classroom teacher is gonna be exposed, as are all the rest of the kids in the building. So it's an interesting scenario.
That was just like if they get the vaccine, then they can
Correct.
come back. But yes, that's all good points.
That's another one of those things that when you go through the college classes for education, that's on a checklist. You will monitor for diseases.
Yeah.
I'm just being facetious.
Yes.
That's on the unwritten rule.
Wow.
Well, I don't know how a nurse, most schools just have one nurse if they have a nurse, so
Correct.
that's a lot of monitoring on one person, so I would imagine they would, you know, put that out to the teachers or the aides to be on the lookout for
Yeah.
rashes or, yeah.
I think we can go to the next one.
Okay.
So just a little bit of what that impact would look like. So then if they did, or if they were exposed and they're not vaccinated, they would have to quarantine at home, which means then they would have no school and or daycare, no travel or outings to public places, no after school or extracurricular activities. If they were older, they would be unable to go to work. Just to like put it a little more plainly and to say like this could go on for a long time. Exclusion from school or daycare continues through 21 days after the onset of the last known case in the school building. If multiple cases of measles occur, the student's exclusion might significantly extend beyond 21 days since the 21-day time period resets with the identification of each new case. And then like impacts for the parent or guardian is they would be unable to go to work if their child was too young to be home alone, which potentially could lead to loss of income. If their child gets measles, then they are now exposed. And if they are not vaccinated, they could get measles and then they should be excluded from work for potentially more than 21 days as that. Especially if there's more than one child in the house and it can go from one person to the next.
We kind of saw that. It was on the last case, so this is 21 days, so you're basically doubling the time that you could potentially be excluded based on the last exposure.
Rita, did you have some comments?
I just had a question around that information. It's pretty stark for the impact on school attendance and a family being able to continue to go to work, et cetera. When people sign the waivers, parents sign the waivers and things, is this information front and center for them? So they know what they're getting into?
Good question. I guess I don't know what the waiver looks like.
I'm not sure if
No.
schools would talk about, that's on the parent to do their own research.
Yeah, you have to be real careful with that. I know that, you know, I can only speak for myself. When people would come in and I didn't see immunization forms and I didn't get them, I would exclude those kids for 10 days, but I wasn't gonna sit down and talk to that parent on the reasons why, you know, they didn't get that. That's just one of those apolitical questions that you don't get into.
I mean, they could call us and we could walk through what could happen. We could be a resource for the
I mean,
parent.
yeah,
to
we
let
could
them know.
potentially provide some kind of letter explanation if the school wanted that to explain it.
And it's dependent on the type of disease that's out there. So pertussis, whooping cough, we did not have to exclude kids. It's just a heightened awareness or close contact, so you know you have been exposed, but it didn't make a difference if they had a waiver or fully vaccinated or not. So it's another factor.
Yeah, I just think that parents might be quite surprised regarding this, if they haven't done the research. And, you know, it's just a lot of the news and information comes on sound bites from, you know, and I just think that to know that they're gonna be out of school, if it's measles, you know, I mean, they're gonna be out of school till the last case and not go to daycare, not go, you know, theoretically not be able to go to work. You know, this would be, might impact their decision regarding whether to jump on that no vaccine, you know, kind of thinking. Anyway.
Supervisor,
maybe- Go ahead.
It's okay if you weren't quite done. Rita?
Oh, no. I just was gonna say it's the information. I don't know if it could be just on a sheet, if they could take a sheet with them at least. Would that be political?
So my whole comment was just to that, you do social media information. Is that something that could be part of a social media? You know, did you know? If your child's unvaccinated and measles outbreak happen, or, you know, whatever happens, that this could happen, you know, just because then it's just, did you know? Is that a way to get a word out without being politicized, without feeling they're attacked? I mean, that's, I'm sure why, you know, school administration can't say, hey, you know, well, you're attacking me, you're attacking my position, my whatever. But if it was just a, did you know? Is that something that could be part of the continued social media that comes out at different times? I mean, you mentioned earlier in the thing that you had a little social media on, you know, on HPV. Maybe that would be
We did do one on measles, but I think it was just like, it was like an infographic from the CDC and it says like, he thinks measles is a cartoon character or something. And then there was like a little blurb that said the importance of being up to date. But I like that idea of the, did you know?
Right.
Like, I think that's definitely a good
if
idea.
this happens and you're not, that you might be out of work, your kid might be out of school for potentially over a month, you know?
Yeah.
This sheet that you have, I think is excellent. Is this something that the schools have?
I think we made it available to the schools. I don't know how much it's been taken, but I think we can definitely like remind them or maybe send them. I think a lot of them are pushing more for like the digital versions of things. So I could definitely offer them to have that digital version.
I think this type of sheet, and I don't know how the administrations react in all 8 school districts, but that kind of information would be perfect to add into a registration packet when they register the 4-year-olds and then the K kids coming in. So it's just part of that registration form. Here's all the forms you need to fill out. Bang, here's from public health.
I think that's a really good idea.
We're actually drafting one page with a bunch of like myths and kind of this is why we're asking, here's some more information, here's some other links you can go to. So yeah, trying to get enough family friendly, easy to read.
Yeah, because we wanted to do kind of like an updated version of that. And it says like what vaccines are required and then trying to put like as much information on there as possible without overwhelming them. And then it talks about like the importance of vaccines. And then there's a link for that. And then Another one is like frequently asked questions, and then there's a link that they can go to if they have more questions. And then just some things that they can do before and after, like their kid gets a shot to get them more comfortable with it. So, I think we're trying to get that information out there. So
Anything else for Crystal?
I was
Nice job. Thank you.
Yeah.
Thank you.
just one more thing. I just wanted to share like what our specific MMR rates for 2024 in Polk County for the 24-month-olds. The MMR rate is 77.9%. And then that's just one dose. And then the 5 to 18-year-olds is 78.6%. So that would be 2 doses. And then statewide for 24-month-olds, that's 81.4%. And then 5 to 18-year-olds, that's 83.2%. So to prevent that outbreak, we are pretty below the 95%.
Good to know. Thank you, Crystal.
Yes, thank you.
Nice job.
Thanks.
Wasn't so bad, was it?
It wasn't actually.
Good, good. We'll have you back again then.
Yeah.
Okay, then, moving on, agenda item 11 is the ADRC Commercial Kitchen Project Update. Mo?
Yeah, not much of an update. We are waiting on one more estimate on the Endeavor's billing again for that kitchen upgrade. We did get an email from the West Coast Regional Planning that thought they found a grant that we could apply for funding for that.
Wow.
At this time, though, I haven't had an opportunity to meet with Nicole Rosso, the new ADRC director, coming on board with Laura retiring, to talk about the subject. This is one that's under watch naturally from executive orders and budgeting. As they mentioned, cuts to Medicaid, and a couple news things did mention Meals on Wheels with that program. So we're just kind of monitoring that also.
Thank you for that update. Just wait and see. Okay, moving on then to agenda item number 12, our Crisis Ad Hoc Committee update. Tanya?
Okay, so let me, Supervisor Olson asked or requested that we keep it going and get in front of the legislators again to make sure that this Western Wisconsin, Western region issue didn't die out. So what we've done is wrote up a follow-up paper, more definition of what the asks are and what we're supporting. At the same time, governor's budget came out. And a lot of the items in there are in support of what we're asking for, but it's on a statewide level. Knowing that it's the first draft of his budget, most likely most of that will get cut and then restructured, but it's a step in the right direction, I think, for us to be able to communicate with the legislators that, what we're asking for and telling you is a need in this area is also supported in the governor's budget. And the legislators have previously said that, we acknowledge that you need these services in this area. So what we're doing with that is taking information down to the Human Services Day at the Capitol that has now been changed to March 27th. I think they had some scheduling conflicts, so they've upped it. I'm not able to go, but we're sending our next best men and women down. That would be Lisa and Lee so far, and maybe others to go and speak to the issue papers along with the WICSA issues that include the fully funding of crisis and CSP programs that we 100% support. So we'll go down and meet with our legislators. Anybody here is invited to attend. So if you want to ride along, let us know. We'll get you hooked up with hotel and a ride with these two lovely ladies over here. So that's already planned. And then with the Western Region Directors Ad Hoc Committee that we've now formed, we decided that, yes, that's important to get down there to Madison, but also they wanted to do something more locally. So we've tentatively have end of April, early May to have an ad hoc crisis summit in Dunn County, inviting all of the Western region. And now we've included Northern region. So I've been in communication with the Northern region directors. They are totally on board with it. So we've got basically the upper half of the state realizing and acknowledging that this is an issue that we need to get in front of with our legislators. So we're working with Rachel Lang, who's kind of our legislator herder, in getting that date defined for us. We will invite you all to come to that. We want our county board representatives, our legislators, our directors, our county administrators to come to the summit to talk about, what are the next steps and what do we support to meet the needs in this area. So that date saver, end of April, early May. We'll get you all the information. We'll load up cars and take them down if you want. Otherwise, it'll be at their Human Service Center on Highway 12. That's what I have for an update. Supervisor Olson, did I miss anything?
I'll just add that, I don't know how far the resolution from Winnebago County got out outside of maybe a few of us here, but I think it was telling when we got a resolution from Winnebago County saying that the northern and western regions of the state needs this. When it's the county that has the state hospital in saying,
Yeah.
They're asking for it, they need it. I think that's a big deal.
Good. We have anything else for Tanya or for Brad on this? Nope. Okay, thank you very much. Thanks for all your work on that.
That took off pretty good.
Okay, then moving on, agenda item 13 is our public nuisance ordinance discussion.
Yes. Do you want to come up with me? I guess I didn't realize that we were on the queue again. Okay, so this is updating. We hear that it is ordinance updating season. So we want to take full opportunity to update one of our longstanding ordinances, the public nuisance section in the Muni Code. So basically what it is that the public nuisance ordinance was written in 1995, before we had our human health hazard. So human health hazard came along in 2000? So 5 years later, human health hazard ordinance gets written and passed. And there's a lot of overlap in that. So we went through with our environmental services folks and our sanitarian folks to compare what actually needed to be in the ordinance. And basically what we came up with is that the entire section of that public nuisance section was either duplicative of our human health hazard or some of the zoning ordinance that is responsibility over in Sarah's group there. So it's just not needed in our ordinance, and we would propose that we eliminate that and clean up our ordinance. So we would just have human health hazard that, can you think of some of the things that, so like excessive noise, that is not a human health hazard. That is not a zoning. That's more of a disorderly that goes over to law enforcement. We don't need that in our language. There's no way for us to enforce it. Wells, I think, is covered either somewhat in sanitarian world or in Sarah's department. Some of the other ones that, every single one that we went through, and we can, if you would like us to show you what we would eliminate, we can do that, or where it crosswalks over into another ordinance that's already covered, we could do that as well. But we would bring that and want that discussion at the county board to be able to drop that language.
So next meeting, what we do is take that ordinance that they're talking about and then just redline it to show you what other ordinance this is covered underneath and why the need to get rid of that one 1995 ordinance would be, because it's already duplicated in these other ordinances.
Sounds like more of a housekeeping
Clean up.
It's more of a
type of issue, but, we can take a look at that, if you think that's prudent.
So you'd like a red line copy next month?
Yeah, the red line version will be in the agenda packet.
yes.
Yes, we'll put that. Yep.
We'll caveat to which line and what other ordinance it goes to. So
Oh, good.
you can see it right there. It's not a very long ordinance. So
Sounds good.
Okay. We'll bring that back.
Any other questions about that at all? No? Okay, then we'll move to agenda item number 14, our update regarding housing.
there's been no new applications for housing, although we did have some interest from some cities and some municipalities on it, but have not received any applications on those yet.
Okay,
So
I don't know if this is a good time or not, just to make mention of the community development block grant situation. So we have some communities in Polk County that have the revolving loan fund for CDBG, and I'm on that committee for the county. It looks like what's going to happen is that they're having a hard time getting people to utilize that as much as they could. And I've worked in communities that had that available, and you kind of, you know, it's available income qualifying for things like siding, windows, basic home maintenance things. But we had a hard time getting people to utilize it, to take that out, and they didn't like having that lien on their house or whatever. And a lot of this is, you know, maybe older folks that are a little hesitant to take advantage of those type of things. So what that has led to is that there's a pool of money for that purpose that has not been getting utilized. So jump in, Mo, if I need to be corrected on any of my understanding of this. So it looks like what is being proposed is that pot of money, I believe it's $22 million, and going from block grant is going to, that money's going to be returned from the communities. And then the funds are going to have, be used to create an affordable housing program to convert underutilized or vacant buildings into affordable housing units. So it would still be used for housing in our communities. There's, excuse me, the details of that are not available yet of how that's going to work. As soon as I got an email from Mo, so I'm going to be attending a, excuse me, a session on that at the end of April.
Along with staff, we'll be doing that to see what impacts we have with Polk County on returning that money and how it's gonna be reutilized. So the letter came this week from Governor Evener to her chair. So that's in process now. And April, after those meetings, we'll have more information on the ifs and what's gonna happen with it.
It was interesting, as soon as I heard from you, I also got an email from the housing director in Chippewa County. So our local kind of county consortium on housing is also holding an informational meeting about this at the end of March, I believe March 27th. So we'll gain additional information then and find out how this new program is going to work. And hopefully we can utilize that in Polk County as well to create additional housing. Brett?
Definition of affordable housing.
Well, I don't know what the current standards are for that. The previous program, it was LMI. Mo,
Affordable housing, Ford Analytics did a great presentation yesterday on affordable housing in Wisconsin. And pre-2021, 22, 71 counties had affordable housing according to the median income and what the base housing is. Currently in 2024, that's down to 31 counties have affordable housing on the, compared to the medium house costs and the medium income costs. So there's 31. Polk County is not one of those that is considered that. In the Ford Analytics link that I'll send out to everyone. As a supervisor, you can hover over counties and see what the medium income was and what that was, and plug in a year to see, you know, how in 2023 there was 41 or 42 counties that had affordable housing, and now that's down to 31 in 2024 of 72 counties.
So it's a straight line calculation,
It's a straight line calculation of medium income.
what they decide that affordable is. Okay.
But for 15 years or 12 years, it was about 71 counties was pretty stable there. And it showed the incomes that were above your housing costs. And now it's dipped down to 90% is below. So, but it's good information on the Ford Analytics, and it was just released yesterday at 11 o'clock. I'll send that link to all the supervisors.
I would imagine also this is something that the Polk County EDC is also gonna maybe be interested in. Do we have, Mo, do you have any comments? affordable housing versus workforce housing. I hear those two terms, and I'm not clear myself on what the distinguishment is between what's termed affordable housing and workforce housing. There's a lot of talk about creating workforce housing and how that differs.
Opinions on that, the data that's coming out right now for population and all that, it shows Polk County's population in 2050 down 30% from what it is now. They show an estimate of 35,000 living in Polk County, which now we have 45,000 people. With the lower demographic of the kids and the younger people leaving Polk County. Board Analytics has in their thing that was released. The outlook didn't look that great for Polk County, nor did it for our surrounding counties due to our aging population. So to put the workforce side of it to the other side, right now we see a lot of growth in New Richmond and Somerset, where that's getting closer now for commuting, and our tax base being lower, than those counties, which may help us out on getting those younger people up this way to commute. So.
And
A lot
childcare,
of data just came out there. Childcare is a whole nother.
childcare ties into that, yeah.
Ties into that with, Neil Klein's group with Family Forward, Family First, showing the need for, childcare in our county and stuff, and how that's dropped off over the last several years.
It all kind of interacts.
But they're all kind of projections.
Supervisor Olson.
So, yeah, I would just say again, affordable housing, I think as a county, we need to know what that means before we jump in and, that's a long ways down the road, but,
Right.
I think the definition of between affordable and workforce may be considerable, as to what not just this county, but any county decides to do with potential money that could come our way, because sometimes affordable is not necessarily affordable.
It's all a perspective and where people are at. Okay, did we have anything else on housing then that we wanted to talk about today? Seems like we have everything covered. Okay, then we will move on to item number 15, our communicable disease report.
All right, so statewide, we still have our respiratory illnesses are high but decreasing. Influenza is still the predominant illness, and then we have COVID-19, influenza, and RSV. So in February alone, Polk County had 15 influenza hospitalizations, 1 COVID hospitalization, and 3 RSV hospitalizations throughout this whole respiratory season. So October 2024 to currently, total of 43 influenza hospitalizations, 6 RSV, and 11 COVID. We're still seeing some cases of pertussis. So since November 2024 to today, we've had 18 pertussis whooping cough cases, mostly in school-aged children. And then I will touch base a little bit on that measles outbreak. We're watching 3 different measles outbreaks in Texas and New Mexico. As of March 5th, we've had 222 confirmed cases. 70% of those cases have been hospitalized, and 2 deaths were linked to that. So.
Did you have anything, Dr. Lagus, that you wanted to add?
Yeah, I think Tanya was talking about norovirus. And I recently learned that disinfectants don't kill norovirus. So if you're using disinfectants, thinking that they're going to be helpful. So the only thing that kills norovirus would be hand washing with soap and water. So if you have any people with diarrhea, soap and water that reduce the transmission, the disinfectants do not. So how many of those people in pertussis were they vaccinated? Any of those?
Many, yes. I don't have the exact numbers, but most of them were.
Most of them were vaccinated. Yeah, I know that adults can get pertussis as well. But I've had patients who had in the sixties had pertussis, and they got it from their grandkids, so it's,
Ew,
we need update.
germ spreaders. Okay, we don't have anything else on that. I don't, sure everybody gets a
Yeah.
chance.
Talk again about H5N1, which started in wild birds. And then it went to chickens, and so a lot of those chicken flocks have been culled, or there's actually a program for the farmers that they get paid if they lose their flocks to H5N1. So probably the easiest thing to do is they kill all the birds, and then they disinfect the barn and they start over. And there has been a transfer to the workers there. Most of it's been conjunctivitis or pink eye. There's a few people have died from H5N1 virus infections, and those have been elderly or immune compromised. The other thing that then it's spread to cows, and cows generally recover after a period of time. The milk is infected, but the virus is killed by pasteurization. If you drink raw milk, contaminated cows, you will get H5N1. Potentially get the infection, and they noticed that cats who roam in barns where there's infection, they generally succumb to the H5N1 virus. There's been some in other large animals, but so far it doesn't look like it's reached any pandemic proportion. So our pregnant mom getting RSV vaccinations?
Are the pregnant mothers?
Yeah.
We're encouraging it. Yep.
Yeah, because that way they can transfer the immunity to their children. Where they're generally too young to receive any immunization. So it's so I think that's something you're promoting among your pregnant patients. And just blanking on there's another thing that generally what's the youngest? I'm not doing pediatrics anymore. So what's the youngest you can vaccinate? Kid, what is it? Is it 18 months for measles, MMR for?
I don't remember, but I do know, based on this recent uptake of measles and where you could be potentially traveling, recommendations that if you are traveling out of country, or known exposure, that you should talk with your physician because you could be able to be immunized younger than typically.
That's right.
So it's kind of a fluid depending on the
Yeah, that's
case.
what I was going to say, that if there's an epidemic, the usual limits on usual recommendations for measles vaccine, I think is about 18 months or 2 years. But if there's an epidemic, you can vaccinate them any age. So that's kind of important to know. I think that's probably all my comments.
Well, thank you for updating us on those things. Do we have a legislative event report?
I think Tanya, it's changed.
Okay.
I don't have any changes and I don't think that Supervisor Bonaprise is on. It's just checking.
Nope, I haven't heard from
He's on.
Johnny, so, yeah. Okay, administrator update, Mo.
Yes, Madam Chair, just a couple things here. Sales tax for January was quite high. It came in 87, almost 88% higher than last year. We're still riding that wave as we're 10% higher than last year in February, although February's sales tax is down 30% from last year. So it's concerning and watching that to see eagerly what happens here in March if that we rebound back on those numbers. We continue to watch executive orders coming out of the federal government. We've slowed down the hiring process currently. We have a 3-month pause on hiring. And looking at to reevaluate our staffing needs, as things change at the federal level for funding. One of those is Medicaid, naturally, has been brought up. 1 in 6 Wisconsin adults are covered by Medicare. 1 in 3 children in Wisconsin are covered by Medicare. So how that's gonna affect our services with the budgeting and funding coming out, we don't know yet. So we're just watching all those things on a daily basis. We're currently working to update our financial policy and procurement. That's on the agenda for tomorrow for general government. And as we started right now, we started working on the budget for 2026 already. The county audit is currently in progress. As Dana mentioned, they've been down at GAM. I believe they're at Highway this week, working on Highway. So that's coming around as we look at our finals for 2024. As mentioned earlier, Nicole Rosso is going to be the new director of ADRC. She starts the end of the month once Laura, the current director, retires. March 7th, Judge Tolan conducted his last treatment court after 8 years. He's stepping down and Judge Anderson is taking over. I want to thank the judge for all his time that he's done with treatment court. If you haven't been to treatment court on a Friday, it's a very good thing to sit in on and support. Also on the museum board, a sad bit of news, Larry Stemtech
Yes.
passed away.
Yeah.
So just want to recognize Larry for his work on the museum board and what he's done for the museum. So
He has really, Larry really did a lot to promote Polk County history and his time in the board to young people in Polk County. He was known a little bit as a tricorn guy because he would dress up in costumes for historical lectures and items he would do, and he had a tricorn hat. So yeah, he's a real loss to that organization. So I just want to note his all of his contributions.
and that's all I have right now, Madam Chair.
Okay, so our subject matters for our next meeting, we're going to be having a red line copy of the nuisance ordinance for our review. We have a strategic plan update on our work plan. Do we have anything else hanging out there from anybody we need to address? Supervisor Olson.
So at our last meeting, we had the frogs in the pond discussion, and I guess I asked the question of, are we doing anything that Polk County or as a county, are we doing anything to keep the frog in the pond, so to speak? So it wasn't on this agenda, so I guess I would ask that it's on the next agenda. That we just have a discussion of, is the county doing anything to keep the frog in the pond instead of getting the frog out of the pond?
So how would we phrase frog pond discussion on an agenda? I will let, you guys handle maybe the wording. I know what you mean, but yeah, to handle the wording on that.
We'll figure it out.
Okay, I knew you would. Okay, we have anything else that we want to bring forth? No? Okay, if not, with that, I will entertain a motion to adjourn.
So moved.
Okay, and any discussions? No? Okay, we'll take a vote. All in favor, say aye.
Aye.
Opposed? We are adjourned. Thank you, folks.
Appreciate it.